Alright people, let's talk about stroke in this video. So what is stroke? So stroke occurs when a blood vessel in the brain ruptures and bleeds, or it occurs when there's a blockage in the blood supply to the brain. So when there's a blockage, said that supply of blood to your brain is tampered with, then we are talking about stroke. So how would you know if you are experiencing stroke? If you are having trouble speaking, do you ever have difficulties when you are trying to speak? That can suggest or be a huge symptom for stroke. Do you have difficulty when it comes to understanding what other people are saying? That could also suggest that you are trying to, or you are developing stroke. Do you get confused many times? Do you have a lot of changes in your behavior? Do you get easily agitated? This can be symptoms of stroke. This can be symptoms that the brain, there's something wrong with the brain. Do you get some vision problems? So do you have trouble seeing with one or both of your eyes? This can suggest that you are experiencing stroke. So these are just some of the symptoms that you can look out for, which would suggest then that you have to see your doctor to check it out if there is any stroke occurring. So what are some of the causes or the risk factors for stroke? What are some of the things that would make it more likely for one to develop stroke? Let's talk about diet. A diet that is too much high, or a diet that is too high in salt, saturated fats, trans fat, cholesterol, these are things that can definitely increase your risk of developing a stroke, and therefore you want to work around changing your diet and reducing salt in your diet, for example. Inactivity, lack of exercise, means that you will gain weight. Gaining excess weight can also be a risk factor for stroke. How about heavy alcohol use? So alcohol has many negative effects on our health, and it includes stroke. So the more alcohol you take, the more likely you are to develop stroke. So that is something we need to work on. Talk about heavy tobacco use or heavy smoking or excessive smoking. The more you smoke, the more you increase your risk of developing stroke. You want to stop smoking to make sure that rather you are reducing your risk of stroke. So many other risk factors for developing stroke. Talk about family history of stroke. Talk about age. The older we get, the more likely it is that we can develop stroke. High blood pressure can definitely be a risk factor for stroke, and we've talked about stress being one of the underlying factors that would increase your risk of developing high blood pressure. Deal with stress, deal with high blood pressure, and then reduce your risk of developing stroke. Too much weight. Too much weight. A lot of studies have shown how excessive weight does negatively affect our health. So you want to work on trying to reduce your weight by checking your diet and also exercising or getting more active. So these are some of the risk factors for stroke, and then we know that quite a number of these conditions, they are behavioral factors that we need to find ways to control. If we can't, we need to seek the help of a therapist or a psychologist to help us deal with them and reduce the risk of developing stroke.